Hey, what's up, guys? Welcome to another question of the day. Sitting here in the lobby at the Oyster Bar in the lobby of the Roxy, and I figured I'd do one more question of the day. So this is a question that I had a breast cancer patient ask me, and the question was, how could radiation potentially affect my results of my breast cancer reconstruction? And this is such an important question because I don't think that most people really understand what happens with radiation. So why do patients get radiation in the first place? There's a few different modalities for treating breast cancer. One is surgery, right? You get a mastectomy or you get a lumpectomy to take out the tumor. Two, there's radiation therapy, and three, there's chemotherapy, and they serve different purposes, and there's different triggers as to whether we recommend one versus the other for you to have. But let's talk about reconstruction and how radiation can affect that. So there are lots of different types of reconstruction. There's breast implant-based reconstruction, and there's your own tissue-based reconstruction. Radiation can detrimentally affect your tissue no matter what kind of reconstruction you have. And I want to give you an idea of what radiation does. What radiation basically does to the tissue is, imagine your skin has rubber band or called elastin fibers that make your skin stretchy. Do you know how sometimes you pull that old rubber band out of the drawer and you pull on it and it just snaps? What radiation does to the elastin fibers in your skin is it basically makes them brittle and non-stretchy. So once you've had radiated skin, it's very difficult for us to go behind that and to place something like a tissue expander that stretches the skin out that we can then go place an implant in to obtain a good result. Once you've had radiation and you don't have breast implants, we're sort of obligated to use your own tissue in the form of a flap reconstruction, where we bring healthy tissue from another part of the body into the breast for reconstruction. Now, let's just say that you had an implant-based reconstruction and then you go have radiation, which is the most common scenario that we see. What can then happen is you can get a capsular contracture, because radiation basically causes the tissue to become tight and squeezed, and that can basically cause a capsular contracture in that breast that's been reconstructed. How do we handle that? The way we handle that is we have to take out the implant and the capsule that's been contracted and put a new implant in. The problem is, we know from the literature that there's about a 30% complication rate anytime you operate on a radiated breast. So I try at all costs to avoid operating on the radiated breast. So what you need to understand about radiation, and I'm going to show a picture of that here on this video so you can see what radiation damage looks like. If you've had radiation and you have an implant, you need to understand that that ups the game as far as the difficulty level for us to obtain a good result. And there's sometimes not a lot we can do to make that breast look very close to the native breast that's not been radiated. So I think it's a good question that she asked about how can it affect the reconstruction, and it can greatly affect our ability to obtain a good result. And it can also make it difficult with the way that you look and feel, as far as radiation can cause a lot more pain in that breast versus the other breast, and sometimes it's out of our control. So I hope that helps answer your question. I appreciate you asking it again. You guys ask the question and I'll answer it. Have a great day.